And we're back, and we're going to talk more about coding fractures and other injuries. More on fractures. According to ICD-10 coding guidelines, if a fracture is not indicated as displaced or non-displaced, it's coded as displaced. If a fracture is not indicated as open or closed, the default is going to be closed. In reality, we hope and need to follow up with physicians on this issue as needed. The majority of the time, these are coded as displaced or non-displaced. When we have multiple fractures, we assign separate codes for each fracture unless there's a combination code provided in the alphabetic index. Otherwise, if we have two fractures, for example, a fracture of the distal radius and the first metatarsal bone, we will need two codes to assign for each fracture. Combination codes for multiple fractures are provided for use when the record contains a statement that multiple fractures exist at one site, but doesn't get into the details. We also have dislocations and subluxations. A dislocation is the displacement of a bone from its joint. A subluxation is an incomplete dislocation where there's still contact with the joint surfaces. And the main terms for this are dislocation by site and subluxation by site. Sprains and strains. A sprain is a traumatic injury of the tendon, muscle, or supporting ligaments around the joint. A strain, on the other hand, is an overstretching or an overexertion of some part of the musculature. A strain can either be a partial tear in the muscle attached to the bone, or this type of strain where you talk about a pull or something of that nature. Now we get into something that we kind of touched on in an earlier chapter, intracranial injury, excluding those with the skull fracture. Category SO6, intracranial injury, is used for various forms of traumatic brain injury that don't include those that happen with the skull fracture. The fourth character identifies a specific intracranial injury. The sixth character identifies whether the patient did or did not have a loss of consciousness. And with certain SO6 codes, there's a reminder. Use additional code if applicable for traumatic brain compression or herniation. Note that there are only three codes for concussion: SO6.0XO, and then a spot for the seventh character, SO6.0X1, spot for the seventh character, and SO6.0X9, spot for the seventh character, of course. The diagnosis of a head injury is less specific and is coded to the SO9 category. Crush injuries occur when a body part caught or squeezed between two heavy objects and is, as the term would say, crushed. The main term is crushed, or crushing, and these are classified by site. Burns and corrosions are caused by a heat source. Could be a fire, could be electrical fire, and corrosions are essentially burns that are due to a chemical. Burns and corrosions are both coded by site, depth, and extent, and by the agent or the external cause. Burns also are coded by degree. A first-degree burn is less severe. This is damage to the epidermis, or the outer layer of the skin only. A second-degree burn involves the epidermis and the dermis. These are the burns that you see sometimes where there's blistering, pink and red wounds and what have you. And then finally, we have the third-degree burns that are the most serious, and these include the epidermis, the dermis, and subcutaneous tissue. This may involve black, brown, yellow, white, and this burn basically has burned away the dermis and has reached or exceeded the subcutaneous fatty layer. Here's an important guideline to keep in mind about burns. If there are multiple external burns, as there usually are, the site of the burn with the highest degree is coded and sequenced first per the guidelines. We still code the additional burns, and they're used for these additional sites. Just using one code for multiple sites is not appropriate if we have specific documentation that specifies these multiple sites. We only use one code, the one code for multiple sites, when the documentation does not specify the other individual sites. There are external and internal burns that may be sequenced according to the circumstances. In other words, what is the main reason for the encounter? Kind of goes back to what we talked about in the first couple of weeks of the class, where we're looking at not only the principal diagnosis, but what's the reason for the encounter? And again, going back, you want to have the most serious coded first. If a burn exists with other injuries, such as smoke inhalation, extremely common, or organ failure, either condition is listed first, depending on the circumstances of admission. If somebody's brought in and admitted, and the reason for admission after study is smoke inhalation, that would be the first code. When there's a burn of varying degrees on one site, one code is assigned for the highest degree on that site. So we only use that one burn code, but if there's a third-degree burn on one site, along with a second degree proximal to it, we're still going to code for just the third degree. And a non-healing burn is coded as an acute burn. If a burn is infected, we're also going to code for the infection. And again, the rule of nines is something that you probably saw in disease process. And rather than talk about it, I'll give you the visual. And here's the rule of nines. Finally, we have superficial injuries. These are contusions of the soft injury, bruises, what have you, and they're classified by site, getting into the laterality, of course. And these are the types of things. Injury superficial is the way we can find them. And of course, they would have the A, D, or S for the seventh character. We also could have injuries to the blood vessels, nerves, and spinal cords. And again, if we have minor injury to the peripheral nerves or blood vessels, the code for the primary injury is sequenced first, followed by the injury for the nerves, spinal cord, and blood vessels. If the primary or major injury is to the blood vessel, the code for that injury is sequenced first. This chapter can seem a little bit intimidating, but again, if you read the guidelines, trust the alphabetic index, and make sure you read the tabular carefully for all the seventh characters and further instructions, I'm sure you'll be able to do well in this area. Thank you so much for watching, and we'll see you online. Bye now.